Hey guys, I'm here with Amy. I just wanted to take a moment to share Amy's story and her experience in the office so far. So Amy, just wanted to share that with people out there. Tell me what brought you into our office.
Okay, so I was up at spring break in Georgia, hanging out with my family, and finally just got sick and tired of not being able to do the things that we've always done together as a family, and watching them go into it and kind of leave me behind. And the reason I was left behind is because I was having such severe neck pain that brought, I believed it was from the neck, vertigo, really bad headaches, a lot of other issues with some swallowing and speech things and whatnot. And I had been experiencing them for many years off and on, so kind of a little bit cyclic. And then over the last few months, it just progressed to the point where it was pretty steady. It was almost daily. Yeah. And after, going to different specialists and doctors and whatnot, trying to figure out a problem and not really coming up with any reason why I would be having these symptoms, just really got a little fed up and started to second guess myself and what my body was feeling. And so that puts you in a weird state of mind, kind of messes with your psyche a little bit. You start wondering if you're imagining it or kind of making it up. And so I think the culmination was that trip. Yeah. Just watching everybody else go have fun and do the things that we had always done, and then I couldn't participate. Yeah. So I was up there and I said, you know what, priority, when I get home, I am going to go do something about this. And so I started Googling and researching specialists in the chiropractic field for cervical spines. And your guys' office came up. So I started reading online the different testimonials and reviews that people had wrote, which there were many really good ones. And a lot of them did have vertigo in them or headaches or things of that nature. And so I just decided to give it a try.
Yeah, so you gave us a call and then tell them kind of what your experience was when you first came into the office. Were you nervous, or how did that first visit or so go in kind of coming in first?
I was really apprehensive, so I had to work up the nerve, even though I had decided to make a priority. Let's be honest, it still took me a few days to make the phone call. So I was sitting in my classroom one day, and I said, you know what, at break, I'm just going to make the phone call. And guys got me on the same day. They were like, hey, just come in this afternoon. So I'm kind of like, I can't back out now. So when I came in, I was apprehensive because I didn't want to be told once again, there's really nothing wrong with you, when I was clearly feeling what I was feeling. So when I did come in, it was so friendly and so inviting. And one of the first things you guys have us do is watch a video. And on the video, it talks about what's going to happen in the office, but also how important it is to ask questions and educate yourself, of the process. And so I think that relieved me, kind of eased my nerves a bit because I felt like I was going to be listened to. Sure. And so when you came in, we had a good conversation. I did really feel like you listened to me, and you were able to not only validate what I was feeling with reasons why I would be feeling it, but you also guided me with diagrams and things that I could go home and research. That helps me learn further about my condition. And it just made sense. And so for one of the first times, instead of leaving a doctor's office feeling hopeless, where I had to go home and just look up side effects of medications and things like that, I really did leave feeling hopeful because there was an actual reason or a problem that could be solved. Oh, awesome. And so that was a really good feeling. Yeah, sweet. Yeah.
And then just share with everybody what you've been experiencing. So we've been under care for a couple weeks now and starting to see some changes. So
definitely.
What have you been seeing?
Since day one, I have not had vertigo one time, and it was constant. I didn't get through one night without a vertigo spell. I also haven't had any headaches. My energy levels have been returning and more than they have been lately. It was funny because I went home the other day and I asked my husband, I said, do I look straighter? Do I look taller? And he said, no, but you look happier. Oh, awesome. And so I was like, okay, so it actually shows, that I don't only feel the results, but it's showing too. Yeah,
awesome. So we got to make that trip back to Georgia now so you can do all this stuff.
Yes.
Well, I love that, you read all those testimonials and now you're a testimonial. Yes. And so we just appreciate you sharing your story with everybody out there. And so you might be out here watching this video and maybe you're struggling with headaches and vertigo and those different types of things. And so we just wanted to share, and I appreciate you, Amy, sharing your story with them. And so hopefully that's a kind of an incentive for you to make that change, make that call in, and see if it's something that we can help you with here at Corrective Spinal Care. We thank you, Amy, for your time, and we'd love to be able to see if we can help you guys. Thanks.